Now it's time to focus on the ATL.
Hello and welcome to today's episode of Focus Atlanta. I'm your host, Keisha Lancelin. Thanks so much for tuning in this Sunday afternoon. In our first segment, we're going to talk a little bit about moms and moms-to-be. Now, some of us don't even recognize that for a lot of couples, it's very difficult to have a baby. Well, I am here with Dr. Mark Perloe. We're going to talk a little bit about the Georgia Reproductive Specialists. Thanks so much for coming on the show.
Thanks, Keisha.
Now, is it more than we think? Is it more often than we think that people have difficulties getting pregnant?
Well, about 1 in 5 couples have problems with fertility.
Wow.
And you went into the segment saying about the women, but it's also the guys that we need to not forget when we're thinking about fertility problems.
Absolutely. So as a couple, approximately, do you think, how long are they trying before they come to a specialist like you, like before they figure out, you know what, maybe we need a little extra help?
When couples have been trying for a year with no reason, it's a good thing to see a physician.
Okay.
But if they know that there's a problem, blocked tubes, pelvic pain, not having regular menstrual cycles, or one or the other has had a sterilization procedure, you don't have to wait the time.
Yeah.
And then when someone gets over 35, if it's been 6 months of trying, we say at that point they ought to see a specialist.
Okay. And how long has the Georgia Reproductive Specialist been here in Atlanta?
We've been around for 10 years, but it was a couple of different people in practice who came together to really practice fertility a new way.
Okay. So when you say a new way, are there different options for different couples, like depending on, what their issues might be? Like, when you first see a couple, do you kind of figure out what options are best for them? Or?
Well, high-tech fertility is obviously what a fertility specialty center does, but it's very important that we stop and look at what lifestyle things may be involved. So many couples come in thinking that they need the most expensive treatment, but we find that there may be changes in diet, exercise, and medication for $4 a month on one of those discount plans that may help them, and they don't need this. So it's really optimizing fertility before moving on to the more expensive treatments.
Okay, speaking of the more expensive treatments, in these days and times, it can be very difficult to find a way to pay for something like this. But I understand you guys are finding a way to help more and more couples to, make their dreams of having a child come true.
Well, the economic turmoil that we're going through has been a problem. People losing their job, not sure about their insurance, and just plain fearful about investing in fertility treatments. So what we have done now is come up with a plan that if the couple purchases or pays for one IVF treatment cycle, there are not a lot of extras with this. They still have to pay the medications, but if there are frozen embryos and they need to come back and try again using those extra embryos, no extra charge for that now, and if a first cycle doesn't work, they get a second cycle free. This can save some people up to 70%. And you know up front what it's going to cost. You don't have to wonder, well, should I just spend another amount and then maybe I'll achieve the pregnancy.
Wow. Now, in addition to all the things that you do there with your patients, you guys also hold like seminars and things. Tell me about those.
We have a monthly information program that we call Fertility Options, and allows people to get a better understanding of all the different fertility factors that we need to look at. Oftentimes, by hearing the questions someone else in the audience, they learn a lot about themselves and say, I didn't think that could be a problem for me.
Right.
And then they know better questions to ask on their own visits when they come in.
That is smart. That's great. Where do you guys hold those typically?
They're in our office. It's usually on the first Wednesday of the month at 7 o'clock. There's no charge for the seminar, and the best place to learn about it is our website, www.ivf.com.
Okay. What does IVF stand for?
In vitro fertilization.
Okay, in vitro fertilization. And that's what most people are coming to you for, right?
Well, many people are, but that's not the only thing we do. We have a lot of women who come in who have irregular menses and have polycystic ovary syndrome. And that's a particular interest of mine, where diet, exercise, medication, people who have a family history of diabetes or are overweight, have excess hair or acne, it may be polycystic ovaries, and we now know, rather than simply birth control pills or ovulation medicines, that we can very inexpensively help these people conceive and be more healthy later on.
Wow, that's a lot of information. Are things like that on the IVF
Absolutely.
website?
We have information about the seminars, about research studies that people can look at and perhaps save some money on treatment, and then all the different treatments we do are outlined on the website.
That's fantastic. How many physicians there do you have?
We have 4 physicians now. Dr. Kaplan, Dr. Susan Conway, Dr. Singleton has just joined us, and myself.
Good. That's fantastic. So for more information, just go to the website.
www.ivf.com, and they can fill out a questionnaire, and they can sign up for a newsletter, or they can send questions in, and we'll review those and provide them some information before they make an appointment.
Thank you so much for coming on the show and sharing all this information. We appreciate you, and we appreciate you guys for tuning in to this episode of Focus Atlanta. Again, it's IVF.com. You can learn more about the monthly seminars. If you need more information, you can learn more about the physicians and the people who are there at the Georgia Reproductive Specialists. So please take the opportunity to go to the website, visit the website, and learn a little more. Again, I'm your host, Keisha Lansling. You're watching Focus Atlanta, and we'll be right back here on CW69. Learn a little more. Again, I'm your host, Keisha Lansling. You're watching Focus Atlanta, and we'll be right back here on CW69.
Focus on the ATL.
Dr. Kukaritz, also known as Dr. Sugar. It's a Polish word. My role in this play